Hi and welcome to my second YouTube video going through my IVF injections. As I said in my last video, I'm a nurse, so I thought it would be, hopefully I'd be a good person to do some videos just going through the injections to try and take a bit of the anxiety out of it. It's actually my last day today of my Gonal stimulation injections before my egg collection in a few days' time. This is the first day I've got around to doing these injections. So these are the boxes that you get. As you can see, I've got two here. What I didn't really notice, because I was trying to kind of be relaxed about everything, I think I was a bit too relaxed about everything, is that there's different amounts in each. So one's got 450 units in it, one's got 900 units in it. So just be aware of that when you get them, because there's I nearly got caught out when I was out somewhere and I'd taken it with me and I didn't realise that I'd only got one dose left in it, so just keep an eye on how much you've got left. So this is the one I'm on at the moment. So this one comes in the box, you've got the pen in there. So unlike the buserelin, which I've been on before, these injections come as a pre-filled pen, so you don't have to do all the drawing up and worrying about all that. They come with some needles in the box with them. They're much like an insulin pen if you've got any friends who are diabetic or you're diabetic. So quite straightforward to use. You've got the pen here. It tells you on here how much is left in it. It's a little bit difficult to see exactly how much is left sometimes. So all you do to load it up is peel the top off the needle here and twist the needle on the end, so it's quite nice and easy, you don't have to worry about all the drawing up. The one thing that is a bit more difficult, a bit more awkward about this injection is that you have to keep it in the fridge, so it's a little bit of a pain if you're going out somewhere or if you're at work, but luckily I've got a fridge at work so it hasn't been too much of a problem. So it's actually got two caps on the end here, so you just pull the first one off. Keep that one handy because that one's easier to put back on for twisting the needle off afterwards. And then it's got another little cap on the end here. So before you take that cap off, you can dial up your dose. So my dose is 125 units, but that's different for everybody depending on your blood test results, so your clinic will tell you. So it's quite a little dial to read there, so I just dial up to where I want, which is there, 125, always like to be sure of that. Take the needle off here and then I'm good to go. I've found that towards the end of my injections, I've been doing mine all on my tummy, but I found it's starting to get a bit sore, so sometimes I go to do it and I find a little spot that I've obviously done it quite a bit before, so it is getting a bit sore, but I'm getting towards the end of it now. You can use the tops of your thighs if you want, but I've stuck with my tummy because it's been good for me so far. So double checking my dose there and find a little spot on my tummy. I found I've got really bloated with these injections, as you'd expect, but so just finding a little spot which hasn't got too many hidden marks in it, which isn't very many, giving that a good squeeze. I find it's easier with this one to go nice and straight with the needle, and you can just go straight in, a spot there, and then just press down the end with your thumb, nice and steady, keeping it still as possible, and then just releasing the end when it's giving you the full dose. And I've found that you want to ideally hold it in your skin for about 10 seconds, if not a little bit longer, just because I've found that you can see a little bit of the injection leaking back out when you take the needle out, if not. So that just helps it to absorb before you take the needle out. And once it's in there, you can't really feel it. And then just gently pull it out. That one's bled a little bit, not too bad. Then you've just got the big cap here that you can put on the end so that you can safely take your cap off there and then pop that into your sharps box, which I will do in just a moment. Should have had that handy really. And then I've just got a little bit left in there, and it's really easy. Pop the cap back on, pop it back in the fridge, and you're ready for your next dose. So I hope you found that useful and reassuring if you're looking at having to do these injections yourself. As I say, I haven't found they've been too painful really, and I've found as the day's gone you get quite used to giving it, and it'll all be worth it if it works. Thanks.